Okay, let's be honest with each other. Going to the dentist is never fun, but for many people, going to the dentist is just not going to happen. Why? Fear, or maybe it's just not emotionally or physically possible. Think about that for a second. Dr. Maureen Toll, she is the founder of Center for Dental Rehabilitation, and she is here to explain how she can help anyone who thinks that going to the dentist is not possible. So good to see you again.
Good to see you, Terry.
All right, I want you to explain to the viewers at home, your practice is so unique and so different. I want to talk about how you treat people in just a little bit, but tell us right now who you treat.
I treat a patient population that has the need to go to the dental office but cannot for some reason.
Give me an example.
An example would be someone in a wheelchair, someone who is not able to communicate, the very young, the very old, Alzheimer's, Parkinson's, terminal illnesses. Lots of challenging cases to where the average dental office really wants to do the best that they can, but they're limited, not only with their equipment, but with their setting. And then with that limitation, they have to find a way or a different practice to refer to, and that's us.
And sometimes it's just plain fear.
Oh, yes.
Right? I mean, there are those people out there who absolutely have a fear or phobia of coming to the dentist.
Statistics say 40 million people don't go to the dental office for the four-letter word fear.
Wow. Okay, I want to talk about Luke.
Okay.
Luke is one of your patients. When I came to your office not too long ago, I got a chance to meet Luke. Yeah. Luke has Down syndrome. And what are the challenges with somebody like Luke? And this is a very typical scenario with patients like Luke.
Luke is a wonderful human being. He just has limitations to be able to communicate with you, to be able to handle and listen to commands. Luke, open your mouth. Luke, can you keep your mouth open so I can put a handpiece in your mouth? Luke, let me put an x-ray in your mouth to take an x-ray. Luke, stand still for a panoramic radiograph.
Right.
Every single one of those are no, and that's just the diagnostic portion.
All right, so you're seeing Luke, who's absolutely a sweetheart. I want to show you a before and after pictures of Luke, because his parents had taken him to the dentist, and they were doing some different types of treatments. But when you saw him, this is the after that you've given him, and you told me the first thing he did, he took selfies of himself.
He was in the recovery room after a general anesthetic, and he was taking selfies, sending it out to his aunts, uncles, and his friends.
I love that.
I know.
All right, I want to take us to the office now, because when patients come to see you, let's talk about how you do what you do. Okay. This is something very unique. A lot of times you haven't seen these patients at all. You have to do your exam, your treatment plan, your x-rays and everything after sedation. That is what makes you different, is sedation is part of it.
There is a huge patient population who can't tolerate what we just described. When you look at that population, even if you could get x-rays, you couldn't do the work. So the
just because they can't, they're not allowing it to happen.
Correct, for whatever reason.
Okay.
So what we do is we actually subject them to a general anesthetic with a board-certified MD anesthesiologist in my outpatient facility.
And we're looking at that facility right now.
That's right. At that time, we can initiate and complete the radiographs, the clinical exam, photographs. Any necessary treatment then is agreed upon with the responsible party waiting for them.
Okay.
And then we go right back in to that room. You see me with my beautiful gown on. But what we're doing is we initiated and completed all of the dental treatment that was necessary on that patient, then brought her to the recovery room for the anesthesiologist and the RN to be able to handle the medical portion.
Wow. It's amazing. It's truly amazing. You're a phenom. No, there's nobody like you, Dr. Toll, and I really appreciate you coming in and telling us all about your practice. So I want to tell everybody at home, because they're probably going, okay, now where do I find her? Yes. I'm going to give you that information. It's called Center for Dental Rehabilitation, and she is located at 16620 North 40th Street. It's Building F in Phoenix. You can call this number to book your appointment and for more information, 602-485-0505. You can also visit the website to learn more, hear stories, see stories. It's drmtoll.com.